Hi everyone, I'm Granger, and my practicum with Island Health focused on community-guided approaches to address health challenges linked to climate change. Today I'll share the project plan I helped develop for the Ministry of Health, a grant proposal. But first I'll touch on some region-specific climate health challenges, and then I'm going to consider how best to tackle this issue by examining the supporting literature. I'll share some observations from my practicum, and we will look at some key island health and provincial strategies before getting into the proposed project. I want to start off by acknowledging that I have the pleasure to live, work, and study on the unceded traditional territory of the Comox Nation, whose people, the Pentlatch, Aixen, Sathlut, and Sasitla, have stewarded their lands and waters since time immemorial. As an uninvited guest on their land, I recognize my responsibility to engage in meaningful collaboration while upholding and respecting Indigenous leadership. True reconciliation is not just about the past, but also how we move forward together, and building just and resilient communities in the face of shared environmental and public health challenges. As part of Island Health's Healthy Environments team, I had the chance to dive into health impacts on climate change. I attended meetings, workshops, events, and co-developed an innovative grant proposal aimed at supporting Island Health communities and adapting to climate change, with a particular focus on water security. Climate change is considered the biggest health threat of the 21st century, and it's already having serious effects on Vancouver Island. During the 2021 heat dome, I don't know why it's flickering. During the 2021 heat dome, 55 people died from heat-related causes in just 1 week. The Island Health currently averages 11 days above 25 Celsius per year, a number projected to triple to over 30 by 2050. Additional projections show that we'll see wetter winters with more intense rainfall and drier summers, increasing seasonal droughts and wildfire risk. As soils dry out in the summer, they tend to absorb less water, meaning that even the limited rainfall that we have, may not make its way into groundwater reserves when it's needed the most. Wildfires, on the other hand, can contaminate water sources with ash, and when fires occur near watersheds, like the Souk fire last summer, heat can also damage critical infrastructure like pipes. Combined with projected population growth on the island, these changes will continue to impact both individual and community health, shaped largely by the strategies we adopt in response. So climate change is a wicked problem. It's complex, interconnected, and collaboration among those with competing interests and diverse perspectives is required. That means a one-size-fits-all, top-down solution often falls short. Traditional approaches to climate adaptation, which focuses heavily on technology, can miss the broader social, political, and environmental context at the community level. Because of this, we're seeing a growing shift towards community-guided, cross-sectoral approaches that build local adaptive capacity. Drinking water management is a good example of this complexity. In BC, health authorities are mandated to ensure access to safe drinking water under the Drinking Water Protection Act. However, the responsibilities are limited to licensing public water systems and monitoring quality, not quantity, while private and industrial systems fall outside of their jurisdiction. Source water quantity is handled by the Ministry of Water, Land and Resource Stewardship, or WALRUS, and other key players like the municipalities, regional districts, First Nations, and industries play roles as well. This fragmented governance structure makes coordination under climate stress especially challenging. In 2021, nearly 1/5 of public water systems in Island Health's region had already faced shortages or drought, showing how urgent cross-sectoral collaboration really is. So where do we start? The literature shows that community-guided approaches are effective because they put community at the center of climate and health action through local knowledge and lived experiences. Similarly, the eco-health approach also focuses on bringing together professionals, community members, and knowledge holders to co-develop solutions that are grounded in the realities of those most affected. This kind of collaboration broadens understanding, sparks innovation, and leads to more holistic, meaningful responses. These participatory bottom-up approaches are also known empowerment strategies that can lead to improved health outcomes and reduce health disparities, ensuring that those most affected by climate change have a voice in shaping climate and health solutions. I had the opportunity to attend several meetings and workshops where I saw how some communities are already taking action. For example, the City of Victoria is working to formalize partnerships with First Nations partners, Capital Regional District, Island Health, industry, community organizations, and local governments. Their goal is to unite individuals and organizations and strengthen collaboration in hopes of improving both short and long-term climate adaptation planning and enhancing the resilience of the broader community and region. I also attended the Watersheds and Wildfire Symposium in Cumberland, where people from a wide range of sectors, including First Nations, municipalities, emergency management, water and fire services, restoration, conservation, forestry, and island health all came together. Just to name a few, there's actually more than that. The primary objective was to explore ways to improve ecosystem health and build wildfire resilience in the Comox Lake watershed. At the events I attended, a clear takeaway was the value of allowing staff to break out of traditional silos, and there was a strong interest in continuing to include Indigenous methods, values, and leadership. While we're seeing some great bottom-up cross-sectoral efforts in Victoria and in Comox Valley, this approach isn't yet widespread. A key barrier is capacity. Organizing these gatherings takes planning, leadership, and funding. Not all communities have the resources to take this on, which means some could be left behind in local climate adaptation efforts. In developing our grant proposal, I reviewed provincial and island health strategies, mandates, and acts to ensure alignment with the current priorities. Unfortunately, I don't have the time to get into all these guiding documents, but it's important to note that both Island Health and the province have made climate adaptation, community preparedness, and resilience top priorities alongside Indigenous rights, self-determination, and environmental stewardship. These priorities show up across multiple strategic plans, some of which are listed here, and align directly with the work we've proposed in our grant. So, all of this research, practicum insights, and alignment with Island Health and provincial priorities fit into my main deliverable of my practicum, which was a grant application to support cross-sectoral community collaboration for climate, health, and all policies in 2 island regions. The goal is to strengthen collaboration, empower local leadership, and ensure no community is left behind when addressing climate change, water security, and health, while fostering a shared path to climate resilience with Indigenous partners. The initiative would be led by my supervisor, Dr. Pivy Abernethy, in partnership with the Community Energy Association, a climate action secretariat for BC municipalities with extensive experience coordinating peer networks, the BC Water Legacy, who are experts in watershed governance and drinking water protection, the FNHA, who will support Indigenous engagement, and Island Health staff like community health promoters and healthy built environment consultants in the regions. Oh, not yet. The project involves organizing 2 two-day gatherings, one in the North Island and one on the West Coast. These regions were chosen because they've been identified as climate vulnerable and under-resourced within the service area with limited capacity to coordinate climate adaptation efforts. The gatherings will bring together local government, elected officials and staff, First Nations partners, and other key players like Walrus, the Ministry of Forests, local NGOs, industry, and private forest landowners. The aim is to bring these diverse perspectives into one space to integrate health-focused language and knowledge translation into climate discussions. A key design feature of the project is that it will be piloted at the watershed scale, which is a strategic decision given the watersheds transcend jurisdictional boundaries and present shared ecological challenges. By bridging silos and creating a safe, trust-building space for collaboration, we hope to foster long-term partnerships and collective action. These gatherings will focus on the impacts of climate change and water and health, laying the groundwork for long-term ongoing partnerships and collaboration and strengthening community resilience. Ultimately, by embedding climate health considerations into decision-making across all sectors, this approach aims to support a shared path forward with Indigenous peoples and encourage mutual learning through the development of regional communities of practice. If the funding is granted and these regional networks prove successful, there's potential to develop a framework for expanding similar collaborations across the province. And in closing, embedding community-guided principles into policy and practice is essential for effective climate adaptation. Building equitable and resilient communities means expertise and perspectives across sectors. This proposal marks an important next step for Island Health to better support local, under-resourced communities. I sincerely hope the team secures the funding to carry this work forward. And I just want to thank my amazing supervisor, Pivy, the entire Healthy Environments team who graciously welcomed me in. I want to thank Margaret, who arguably has the fastest email and marking response time of the department. And I also want to thank Dawson, who became such a good cook because I was working a lot. And finally, the local leaders in Cumberland and Comox Valley who just brought me in. Even though they had no part in my practicum, they realized I was doing what they're trying to do and introduced me to all these events and workshops. And I'm really grateful for that. Thank you.